I'm going to discuss about dental care and dentist visit. My name is Angela. Join me in my first video in Angela Speaks. We'll discuss about 4 topics for today. One is the causes of tooth decay. Second is the signs and symptoms of tooth decay. Third one is when to consult a dentist. And last is our personal experience in accompanying Athena to her first dentist visit. What are the causes of tooth decay in toddlers? Clearly, the main culprit of this is eating food with sugar and starch. And our Athena just loves to eat those. So she's always asking for snacks. And her favorite snacks are wafers, marshmallows, biscuits. She always asks for that. So that's clearly, one of those things that we haven't monitored. And I think not frequently brushing her teeth was also one reason for it. So those are the things that I can recall, and those are the causes of tooth decay for her. Signs and symptoms of tooth decay in toddlers. Our greatest challenge was communication because Athena cannot express herself effectively. Communicating is something that we are working on. And the next question is, how did we know that she has tooth decay? How did I know that she has tooth decay? Athena showing signs that she's always pointing inside her mouth, like she's pointing inside her, she's pointing to a particular teeth or tooth. So we just really don't know what is it yet. I mean, it was difficult to determine what tooth or where is it, because she's always just pointing at it like this. And then at night, that's the sad part, she has difficulty sleeping. So painful for us to look at our child when they are in pain. And what I did was to take matters in my own hands. So I just inspected her tooth. Even when you're brushing her teeth or you're brushing your child's teeth, you won't be able to see it unless you really inspect it, like really look at it. So I saw that her I think it's called the second molar, it's affected. So second molar. What? So I actually have to look at it up, and the second molar is the biggest and the farthest tooth that erupts and appears at the 23rd or 31st months of age. So so this is the picture. You'll see the picture here. For me, there's a sign of a discolored or brown to blackish color on the tooth. So you'll see it, and it was not really that obvious before. But when I tried scratching it, it's not chocolate, it's not food. It's not food at all. So it's a hole. You will see that it's a hole if you really try to clean it very well with the brush. And I thought it only involved the second molar, but wait, there's more, and it's actually 4. So yeah, I have to really see a dentist. When to see a dentist? Obviously, the pain that she felt was enough reason for me to consult a dentist. And the second thing is that Athena has speech disability, and I am afraid that having a tooth decay or pain in her mouth, in her tooth, would hinder further learning. And she's in therapy, so I need to keep her healthy, keep her in shape, so that she'll be able to effectively listen and of course learn how to speak. For all the parents out there, for any sign of tooth decay, please, just bring your kid or your child to the dentist. We went to the dentist in Pediatric Dental Center of the Philippines, PDCP in Quezon City. I recommend this place because they really took care of Athena. And for you or those people who have children with special needs, this is a great place to go to. They really know what to do. So, time we went there just for checkup, and the dentist wanted to know the case, how is the extent of the the tooth decay, and what really happened. The procedure is called pulp treatment and crown tooth fillings. So it will take like about 4 of that, and I think it's also the best way to do it because seeing the teeth of Athena, she also needs a fluoride treatment. It's best for her condition. And the other question was restraints because Athena cannot endure that long procedure. So I'm 100% agreed to putting her under anesthesia. I think this is one thing that would make her feel comfortable, and of course there will be less pain. She wouldn't feel anything. She would just wake up groggy and kind of sleepy, but I think that would be the best for her. So before the treatment, we needed to seek medical certificate because a medical certificate from a pediatrician is needed before the procedure itself. We have to understand that this procedure will include anesthesia. Prior to the day of treatment, we got a call from doctors. They wanted to know our condition, like how we are doing, how is Athena, and there's also sort of interview about the medical condition and dental history of Athena, which is really good because it would lessen the time of just filling out forms when we're already in the hospital. When we were traveling, we wanted to be safe, of course, so we were in full battle gear, and I can say that this facility is very efficient. When we went there is a schedule. So we were the only patient that was scheduled for that time. So in the waiting room, as you can see, we are the only ones there. So I really felt safe. They began the treatment. It only lasted for I think 1.5 or 1 hour and 15 minutes. It was over. So as a recommendation or as advice, please do not feed your children after this procedure because they are not going to really take it well. So they will just vomit. So just take time, let them sleep, let them rest. After about 6 hours, she finally asked for food, and that's the best time because after asking for food and then eating slowly, that's the best way. And she started being the same Athena again. So she was wandering around, but we needed to be aware and we need to guide her because the effects of anesthesia is still there. So we have to be very careful. So guide her and just be on guard. We were really concerned because not really that eating well because I think it's still part of the side effects. So we treated her for a cake. It's one of her favorite food. But this time, after eating cake, we have to brush her teeth. So she's okay with it. So stay tuned for my next video. So this is the video of Athena on her first checkup after the procedure. And hopefully everything goes well and that we don't have any problem with her teeth. Stay tuned. See ya. Hope you like our video for today. And please do comment if you'd like me to discuss about other topics. So don't forget to subscribe, click the notification bell, and please like the video.